Hey, Jamal. How you doing, man? You see what I see? You don't see it? It says I'm on the air. And what live stream? Live stream. Mhm. Um, oh, you know what? It's caching. So no, it's not. It's so yeah. Start the live stream. But it says my cache is full. I can stop it. Okay. So I'm trying to see. All right. I'm reading what you said. Try to start it again. Start it again. Okay, we should see something now. Nothing yet? Okay. Yeah, it says it's caching. So it says it's caching at 50%. So I'm sorry. I think you have to press the button that says stream now. Yes, it's caching up. So it's caching. So it seems like it's not going to direction. Yeah, it's caching up. So no, okay. So at the bottom of your notice screen, let me see if I can pull this up. There's this thing, I don't have the login information. Do you have her email address? Her login? I'm sorry, Joanne. Okay. Yeah, J Mary. Oh, spell her last name. R-I. Okay, what's the next part? Go back. All right, say that again. You said boss, BOSS, golf. Mhm. Okay. Mhm. Use. Okay. Okay. All right. What's the password? Waking up. Yeah, really sitting next to each other. Mm-hmm. 18. Mm-hmm. Uppercase C? Okay, I gotta go back. 1482? Okay. Okay, so spell out Columbus. Okay. Mm. Hold on a second. I didn't get that far. Columbus. So spell that for me. Mm-hmm. 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 Dollar sign. Uppercase L. Okay. OS. Of course, I gotta go back. And it's not showing me. It's not showing me anything. Okay, so 1482. All right, cool. All right, cool. All right, stand by. Stand by. Well, yeah, I'll just call you back. Yes.
So everybody's in.
Let me see.
Okay, ladies and gentlemen, we will be starting shortly because I know we have a lot of our CEOs online, and we have our senior leadership here also that has other commitments as well. So within a few minutes, if you could just take your seats, and we'll get started in about another minute or so. How are you? Nice to see you.
There's nothing because that computer is the same computer.
Okay, ladies and gentlemen, we're going to get started. thank you everyone online. And I just got an update. We have over 50 women philanthropists, investors that are here to join us. Feel free, this is a closed door roundtable. People can only join, using a code. So this is really, the time in terms of looking at strategically, how we work together to invest in women's health in the African continent. So I am very honored to have experts around the room, global health leaders that have not only been championing this issue for many decades, but have also actively implemented these programs with the countries on the ground. So I won't take any further time. I will turn it over to Ambassador John McKinnon, who's had a long record of not only leadership, but I'm truly humbled by a lot of his hands-on work, specifically under the COVID-19 pandemic. I think we owe him and a lot of gratitude for everything that he's been able to accomplish in such a short period of time. And now I know that there's so much more in his new role over at US PEPFAR. So Ambassador McKinnon.
Thank you, John. Let me, first of all, recognize the ministers who are here. Honorable Minister of Nigeria, Permanent Secretary of Botswana, good amount of time with the First Lady yesterday, and all colleagues. I was staring at you as you work in this a few minutes ago. Someone said, how do you do this? I said, to tell me, I'm very fortunate to be in Washington at this time, because if we had to do this, have these conversations, a series of conversations planned, it will take 3 years to go to secure a meeting and meet all the leaders in health that we've seen in just the last few years. So this is very, very, very good. So I really want to make 3 points. One is the critical, the central role that women, young girls, or what we say, adolescent girls and young women play in the overall developmental agenda. And it starts with health promotion. And I was approached that from the lens of HIV. When we see where the burden of HIV is, so let me just pause here also to recognize someone who was Mr. HIV/AIDS for close to 10 years, Michelle Debay, was the torchbearer for the direction we had to fight HIV/AIDS and UNAIDS for. So a lot of the things that I was saying in the area of HIV/AIDS connect and relate to what Michelle has championed. And he and I were in Senegal just last week, meeting with President Macky Sall, and the same discussions were playing out. So when we look at, when I came on board 6 months ago, and we did a listening session across the board, talked to some of you, many of you in this room, about where we should go with PEPFAR. It became very clear that where the burden of the disease is in children, adolescent girls, and young women, and key population. But let me just focus on adolescent girls and young women for 1 second. It has tremendous implication in terms of the development and economic growth of Africa. The session we had the other day with President Masisi from Botswana and President Museveni, I framed the discussion of HIV/AIDS in 3 lenses. I said HIV/AIDS 20 years ago was a serious security threat, was a serious economic threat for the continent of Africa, and a serious developmental threat. And that is true, because the life expectancy has dropped significantly. But if you see where we are today, the risk is that the populations that I just characterized, as adolescent girls, young women, and women, as a whole, bear a big burden of the disease. The First Lady of Botswana gave some very disturbing statistics yesterday about the burden of HIV/AIDS in Botswana and dividing that up by gender, I think up to very disproportionately affecting almost like 79% to 30%, which is very troubling. But I see there an opportunity. And that takes me to the second point, which is where is PEPFAR going with where do we hope to go in the next 5 years? We just released a strategy on reimagining our strategic direction in the next 5 years on the 1st of December. And essentially says that we should focus our energy where the burden is, which is the population and the state. But very importantly, look at sustaining the response through the lenses of political leadership, financial leadership, and programmatic leadership. It also speaks to partnerships, and that is where I want to expand a little bit more. Partnership more broadly. And the kind of partnership that I'm looking for in PEPFAR is recognizing what traditional partnerships have done, which is you walk into a room and see Roche, I see here a Roche colleague, you say, and I did one partnership with Roche many years ago when I was at the US CDC to advance diagnostics. But those kind of partnerships are okay. When you look at partnerships that will require that we look at development banks and say on the continent of Africa and elsewhere, the way PEPFAR operates and say, where can we build a partnership? Okay. You look at the private sector in Africa and in the United States and say, where can we invest? And there are many opportunities that offer themselves for investment to address women's health on the continent, recognizing what I just said earlier, where the burden of the disease and the criticality of that population. So we are looking at, I've met with the leadership of the World Bank. I will be heading to Abidjan mid-January to meet the head of the African Development Bank. I'll be meeting tomorrow with the Afro-Exim Bank to say, this is not just charity, this is there's investment opportunities if we look at it carefully in so many areas. So my appeal here this afternoon is really to engage with the CEOs that are here and say, look, we have an opportunity for partnership within PEPFAR underneath that pillar, which we call partnership. We call it transformative partnerships, which is not just donations, generous donations, but see that as an opportunity by doing good and doing well. I mean, and nothing says you cannot do both, doing good and doing well. Let me just end by saying that by describing a program we've supported over the years, that is PEPFAR, USAID working closely with us, and USCDC. It's called the DREAMS Initiative. That is investing in young women and adolescent girls, and who are not necessarily infected, but who are young women that you want to empower them. DREAMS is stands for determine resilience, empowerment, AIDS-free, mentorship, and safety. So over the years, I think we are reaching out 3 million young women and girls, and empowering them. I was in South Africa in August with Secretary Blinken and had the opportunity to see and interact with so many of them. It's one of those programs that is loved across the industry, and we want to be committing ourselves to maintaining that. I will be looking for new partnerships to expand and deepen the DREAMS program in the countries that exist, or expand that to countries that do not have that program, because it's really, you can see how if you empower these young women, how they can produce stuff, they become entrepreneurs in the community, and clearly that puts them out of the risk of being infected with HIV. So it's an investment area that I'm putting on the table for all of us to consider, because we're putting in a lot of money ourselves, about $200 million a year in that particular program. So thank you, Claire, for saying Claire, Yuan, for she and I have a common friend called Claire. She's probably on the call. So we've been having yeah. So let me end there and say I'm looking forward to a very exciting conversation. assist in this.
Thank you so much, John. And I think the welcome, engagement with the different partnerships is really what you have both around the room and also online. You have Sonia from British Invest International, and you also have Christina from the European Development Bank. And I know that both are very investments into gender are key into some of those new partnerships. I'd like to take the conversation over to Runa, who is heads up the development, one of the largest private equity firms on the continent, and has done a lot of creative investments around, how to look at women's health. And as you were saying, John, it's about the partnerships and really looking at the private sector on the continent that's currently investing in a lot of those big funds. And I know they've recently, have several funds that they're closing. So I turn it over to you, Runa, to really, take on John's comments in terms of that partnership and how you deploy and as private sector work closely, with USFR and with the different government partners around the room as well. You're on mute.
Thank you so much, Joanne, and thank you, Ambassador. So just a quick description of who we are and what we do to put into context what I'm about to say. So I'm founder and CEO of Development Partners International. We are a Pan-Africa private equity fund managing about $3 billion. And the only thing we do is invest in continental Africa. And I've been investing in Africa for 23 years. And this company, DPI, for 15 years. So one thing I should start with is that the development of a very private sector industry, private equity, is very unique in Africa. And it's built in a way that one can do partnerships very well. And that's because our whole industry was started by the development institutions. So I see EIB, BII, you guys are investors, as are 14 other DFIs in our fund. And why did they do this? They did this because from day one, the idea was to invest in good companies, make them sustainable, but do it with also excellent ESG and impact. So our fund does ESG, and we do 3 buckets of impact, which touch about, well, we focus on 10 of the UN SDGs, including 5 gender, and we really we focus on 10 and we touch all 17. So the 3 buckets are, number 1, gender, and in gender, like with the other 2 buckets, we always strive for outside measurement, so we can be held to task, we can be compared, and here we're working with the DFIs on the 2X challenge. So everything we do is off the 2X challenge criteria. What does that mean? It means putting women in leadership roles, more women in companies, and looking also at products that are aimed towards women. We also do climate change and job creation. In job creation, we also focus on bringing women in and making sure there's safety, non-discrimination policies, all sorts of things like that. So it's a very holistic approach. We are 100% private sector, seeking highest returns. And we believe by doing that, we can invest in companies that are sustainable, because we have to make them competitive. So long after we invest, we work with them, we sell them, that DNA of the work they do is there, and they become bigger and bigger and have more and more impact. Yeah. So how do we touch women's health? First of all, we do it intentionally through our 2X challenge work. And what have we done? We've invested about 500 million, and it's soon going to be 700 million across Africa. Our biggest area is pharmaceuticals. 80% of pharmaceuticals in Africa are imported. And that means they can be quite expensive. Pharmaceuticals, whether they're formulations or medicines or therapeutics, often don't go throughout the whole continent. So we have done one company that exports both to Africa and to Europe, and has a lot of products that are relevant to women. But then we took on a Pan-African pharma company. It's the first one that's being built. And it's with the partnership of various development institutions, And the two who are here, VII and EIB, are EBRD are investors alongside us. And there's two stated goals: get pharmaceuticals as many places in Africa as possible and reduce the cost by 50% to the African consumer. The third company we're doing actually has products specifically geared towards women's health, which we're very, very happy with. All of these companies are amongst our best companies. They're growing, some of them at 30-40% a year. And we have put in tremendous work on the ground working with them. The next areas we're looking at are clinics and hospitals. And then because we're doing so much in the digitization area and also with venture capital, we're also looking at digitized delivery of healthcare to women. So the partnerships are everywhere. We need the help of governments to, it's an old word, but it's as relevant today and maybe even more so after all the shocks this year, to create an enabling environment. You know, we have FX problems in Africa. We have all sorts of other things, and we need the help to partner to have an environment where our companies can grow and work in a proper way and deliver their goods and services. We need the collaboration of lots of different parties. I, for instance, sit on the board of CARE, and there we are working with venture capital companies coming out of the humanitarian and development area that come into the private sector. And there's a way of collaborating with us and others on that. And of course, we already partner tremendously with the development institutions all around the world. So I'll stop there and thank you for including me.
Thank you so much, Runa. And we look forward to working with you on some of those innovative financing vehicles that we'll be discussing. Also, those that target the base of the economic pyramid. I'd like to turn the conversation to Dr. Atul Gawande. I know that there's USAID has done a lot of investments into primary care, as Ambassador Nkambansan mentioned and Runa mentioned. The partnerships that are required, are both public and private, and that USAID has done a lot of that in terms of, both primary healthcare and also expanding the range of what, I know the private sector refers to as non-traditional partners in their types of investments. So if you could comment to that a little bit and also give advice to some of our, investors and women philanthropists that are actively brokering these partnerships right now. I know another fund that's going to close for women's health. That's a $350 million fund that will have a technical assistance arm of $20 million for primary healthcare. So, I know that they're anxious to work with you, with USAID and US PEPFAR.
Well, I'm so excited to be getting to have this conversation and hear about some of the investment work already underway. I was lead at Global Health at USAID, and the way I think about health equity and protection of primary care is by starting with recognizing that there has been progress, but the progress left is still very deep. 60% of deaths in 1990 were in women under 50 and children under 5. That has advanced to the point that it is now 40% of deaths are in women under 50 and children under 5. During that same period, however, in places in the continent of Asia and in Latin America, those numbers went from 40% of deaths to 10% of deaths. That is the definition of health inequity. One of the critical other sources of inequity is that cannot be solved when Africa has 1/4 of the global burden, but only 4% of the health workforce. And the most critical element of the health workforce is the primary health component. The evidence is that if you have health systems that are rooted in strength in primary health care workforce, that is what produces a lower mortality rate for women and children, improved equity, and also improved gender equity, as well as increased cost efficiency. Now, what do we mean by saying rooted in primary It's not simply that you have a primary health center that people can go to. The critical element is that you have a community-based workforce who are able to reach out and touch every home in the community, ideally in the country, at least once a year. But that community health workforce that reaches out is not doing it just for, I get to run in some sense, but we have a TV program, a malaria program, our blood tropical program, we have our maternal and child health efforts around childbirth and nutrition, et cetera. But all of them only end up working through the same workforce. And that workforce is the community-based workforce that every home is trained at least 12 months when it is working best, when it is not just having in one area, but it is what we call the polyvalent. And their salary. So they're reliable and secure. And they're not on their own, they have to be connected to a higher level primary health clinic system where the problems that they can't address in a small community can be elevated into a functioning system. Much of the benefit that they bring comes from touching people who've been lost to the system, and moving them into a system that is functioning. Evidence that it has remarkable effects. But USAID, our funding comes in these vertical contours, but we have been committed to continually reducing that contribution to deaths of women and children as an indicator of the health of the total health system and workforce for everybody in in the country. It's also important to recognize that 70% of that healthcare workforce that touches the community are women, and this represents a vital employment opportunity as well as a way of equity economically. We announced at the Africa Leaders Summit just a couple days ago a commitment to accelerating our investments in the primary healthcare workforce by coordinating with all of our investments in USAID across our multiple offices in these areas, with the President's Malaria Initiative, and with the Global Finance Facility, which works on advancing women and child survival with World Bank. And we're doing it starting with 5 focus countries where we want to coordinate our investments in order to enable these pathways. And those starting countries are Cote d'Ivoire, Ghana, Kenya, Malawi, and Nigeria. The efforts have been partnered around the investment cases that the Ministry of Health already made with the World Bank. And we want to be coordinated. In addition, I want to thank John Henderson for also committing that PEPFAR will work with us in Malawi to also bring PEPFAR funds around this coordinated effort. Take the example, for instance, of young women receiving contraception, long-acting contraception, but not being assessed for risk and provision of HIV. And therefore, they're coming back with HIV. And then we're seeing HIV patients who are being given PrEP, or not being protected from HIV, and being given PrEP, but coming back with unintended pregnancy. And the chance to work together so that we're ensuring that the full spectrum of services are being connected across all of our programs, but in ways that are also members of the health system. I'll also add that we announced at the Africa Leaders Summit just yesterday, a public-private partnership along the lines of some of the ones that we've talked about with the financing vehicles. USAID put in an initial 1 million in capital funding, which leveraged 10 million in development finance corporation funding, which leveraged so far 50 million in the first round of investment for a public-private investment partnership focused on innovation, women-led, majority women-led innovation in advancing health equity, especially around healthcare.
That's a great announcement.
Yes,
So thank
we're,
you.
We're excited to be
Yeah.
able to do it and to have $1 million
Yeah.
leverage that far from the USAID is also very good. So we're excited by the
Thank you so much. And I think that is, where we want to get a lot of this group is really practical because we have a lot of leaders in the room that have these innovative financing vehicles that, they're deploying. And with that, I'd like to turn it over to the Honorable Minister from Nigeria, to talk about some of the work that is being done around women's health in Nigeria related to, finding new vehicles for financing.
Well, thank you very much. First, I want to say that Dr. Atul Gawande has put a picture most accurately. If you want to know how to go about healthcare in developing countries, particularly in Africa, just take what he has said. You need to start at the basic level. For most of the past years, we have worked on that, and hopefully we trickle down. Health does not work that way. You have to start at the base and also address those things that are of public concern, of international concern. Identifying disease outbreaks. We do that at the grassroots. We don't do that at the top level. And also responding to health threats. And again, all programs of prevention. Everything happens at that level. Simply train health workers. And if you have exceptional workers or any kind of personnel who at that level are able to do the most simple tasks. Of course, the purpose is to provide healthcare. And 60% of the deaths in children under 5 come from malaria, diarrhea, and pneumonia. And that can take care of, even at that level, to reduce mortality and also the mortality among women. And going back to what John spoke about, one of the weaknesses in our program, we have done very well, and thank you for the compliments, the HIV/AIDS response. But the weakest spot at the moment is the prevention of other child transmission of HIV. And that's because to be able to locate the program, we have to find the pregnant women and test them and also put them on treatment. Then you can avoid the prevention, you can prevent transmission from mother to child. But if you don't have a structured basic healthcare system, and if you do have systems that they don't look trustworthy, you get very low attendance. And so you can't actually get the mothers and put them on treatment. So unless you strengthen healthcare at that level, there are a lot of things you will miss out. And once the basic healthcare is strengthened, then the rest of it is actually quite easy, relatively easy. So again, I want to join in saying that where you want to put your money is at the level of basic healthcare. And in Nigeria, we're trying to draw attention to that. I'm happy that Nigeria is one of those we are working with now to drive that with the population of around 14 million. We have a lot of excuse me. We have a lot of room for investment, a lot of room for improvement. And if you look at the mortality rates and so on, they all come from the grassroots level. They're not in the cities. They're not really having big hospitals. So that's where we are addressing, in fact, all problems. Right now, we're talking about women and There's a lot of inequity, actually inequity in healthcare too, between urban and rural, and between male who run the society and then the females who are more or less not, many of them don't have the awareness or the education to speak for themselves. So education, their child education is also critical. It's part of what the investment that is required to allow child-specific nutrition. And as far as nutrition is concerned, 50% of malnutrition in Africa is caused by just not knowing what to give. They have the right food, but they give the wrong one to the children. And if you just do a little education and they know exactly how to feed their children, they're going to reduce malnutrition by almost half. So the primary health care is also a vocation to educate people, educate the women, educate adolescents, educate their fathers, educate all those who are able to do the health at all on all the things that are necessary for reducing waterborne diseases, vector-borne diseases, vaccine-preventable diseases, and so on. So that area is the most important. With regard to cancer care, yes, that's also something that's growing. And there's in fact also evidence, anecdotal evidence, that there's an increase in cervical cancer in women in the oil-producing areas. It's not yet clearly established, but we are thinking that the pollution, the hydrocarbons and heavy metals use for exploration might have a role to play in that regard. And the tertiary hospitals in that area are all complaining and beginning to say that we're seeing a strong increase in some cancers in these areas. So the evidence is still being collected. So the government is also putting a lot of emphasis on prevention and early detection. And where would that happen? Again, at the grassroots level. Before they get too serious and before they reach the tertiary level, where it becomes much more expensive and where the outcomes are much more unlikely to be successful. So if you catch them early at that same level, that's when you have the best results. The government is investing considerably in cancer care. We have 8 new cancer treatment suites, radiation and therapy, and we are definitely in need of more of these investments. We're open to all models of investment, fully private investments, joint ventures, and also those that are working through international NGOs. Those ones are all open because, like, with a population of around 14 million, you have a very, very wide area that requires investments of all types. Some of these investments are being conducted by internal NGOs and local NGOs, and also by foreign NGOs. So I would like to stop there, and I will ask Dr. The Director of Health Planning and Research to take over here.
Yeah, and before we do that, I'd like to take it over. I know some of our women investors on the line need to leave, and you talked about investing. And I know Sonia heads up British Invest International's gender programs. And one of the things that British Invest International has been a large member of the 2X Collaborative. And I always say to people, it's not lack of money, which we've heard from our private sector partners. It's how to deploy it in a way that is most efficient. So Sonia, if you could please, give us a little bit of background into British Invest's, some of the, investment profiles that you're looking at for gender. And I know, there's a lot of infrastructure and what you're planning and how the partners can work with you.
Sure. Hi, everybody. It's a pleasure to be here this evening, my time, this afternoon, your time. So my name is Sonia Jordan-Kerwin. I'm BII's Gender Finance Lead. British International Investment is the UK's development finance institution. We recently rebranded from CDC Group, so you might also know us by that name. BII has a long gender journey. It's got a long history now. So in 2018, we officially launched our gender strategy, and in that same year became a founding member of the 2X Challenge, which Runa has so eloquently spoken to. That essentially was a mobilization target to I suppose encourage the G7 DFIs to commit $3 billion towards advancing women's economic empowerment. That was exceeded 3 times over, and subsequently we have set a new target for 15 billion for the period 2022 to 2021 to 2022, so we're just approaching the end of that. BII has fully integrated gender into its investment decision-making processes, so we have corporate targets for our commitments each and every year. We table kind of gender considerations as part of each and every investment committee meeting, and our teams internally are also incentivized. So we've built it into our impact scoring system, which means that all of our investment professionals are incentivized to be on the lookout for either deals that have gender equality as a central component in terms of kind of the performance, I suppose, of an investee as at the point of investment, or the opportunity for us to support investees to become more gender smart over time. So very much built into BII's way of doing investment now. We don't invest significantly directly into healthcare. There are a number of reasons for that, though we are able to invest through our intermediated structures, including DPI, and Runa's already spoken to that. But I did want to just highlight a few of the ways in which we're investing in the African continent with kind of gender very much in mind. So one of them is through an investment in Summit PE, which was actually a first time, so an emerging fund manager that is Black owned and led, and qualifies for the 2X challenge under leadership, employment and consumption criteria. So a really clear front runner with regards to 2X. What's really critical about Summit, they're a generalist fund, but with a focus on healthcare and financial services, including primary healthcare. But what's very much front and center of their own investment thesis is to ensure that transformation is a key part of this. So that means in the South African context, it's a South African and Southern African focused fund, thinking about how they can support companies once invested to become more gender diverse and more ethnically diverse, with a particular focus on Black economic empowerment over the course of their investment term. So that's one example that we are invested in, which has kind of a strong gender element. Another is Diversity, which is an affordable housing organization, also South Africa based, where 45% of the leaseholders are women, which is against a 25% average within South Africa. So really making affordable housing available to women. And then another example would be an investment in FMB, where 100% of the use of proceeds of our loan is directed to female-led SMEs. So those give you a bit of a sense as to some of the different ways in which we are investing with a gender lens within the African continent across a range of products, from funds through to direct equity and direct debt. I think I also wanted to highlight a few things that we struggle to invest in, which have strong gender impact, because I think it's important to be honest. And we have very large ticket sizes. So typically our smallest equity ticket is around 20 million, which really limits some of the things that we'd like to be able to do from a gender perspective. So we're not able to invest in as many first-time emerging female fund managers or gender-balanced teams as we would like to, and we're not able to invest in quite as many female-led businesses as we'd like to, because typically the sorts of investment tickets that we see female founders looking to raise sits below what BII is able to invest directly, which is one of the reasons why our investment in financial institutions and also funds are really critical. But I wanted to highlight it because I see that also as an opportunity. And one of the things, Joanne, that you asked me to highlight is, you know, what are my recommendations for other investors in the room? And one of the things I would say is try to invest where we can't. So the DFIs have played a really key role in supporting bringing a gender lens to the continent, but there's certain things that we can do readily, and there's certain things that are much, much more challenging for us. So investing those smaller ticket sizes is a really important one. That being said, also wanted to highlight some of the ways in which we're trying to push the boundaries when it comes to gender smart investment within the continent. So over the last year, I've been doing a lot of work to try to build in much more systematically commercial incentives for gender outcomes within our deals. So we have just recently invested, we supported to establish the African Forestry Investment Platform, which is a permanent capital vehicle which has been set up to invest in forestry projects, climate smart forestry projects in Africa. And as part of that, we've built in an impact related carry component, and gender is one of 4 components to that. So essentially, the more 2x businesses that the platform invests in, the higher the carry payout, which is a really clear way in which BII is looking to incentivize gender outcomes through kind of the commercial terms of its deals. Another example is in one of our debt investments, we have built in a marginal rate reduction of 10 basis points if the investee meets targets around female representation and senior leadership. So they pay, essentially, in layman's terms, they pay less interest if they meet their targets with regard to female representation. There are a number of other things that we're looking to do and that we are piloting and hopefully making much more mainstream within our portfolio, but that hopefully gives you a bit of a flavor as to some of the ways we're trying to be a little bit more intentional. A final one is investing.
Tony, I'm going to have to stop you there. Sorry about it. But thank you so much. I know the partners are looking forward to working closely with British Invest International. As you said, it's that gap, the ticket item that, as that can be bridged in order to make it compatible. And I think with the partners here around the table, both, US PEPFAR and some of the, women philanthropists that we have, we're able to kind of bridge that gap. And I think Dr. Zainab, if you can talk a little bit to that innovative financing vehicle that in terms of what's going on in women's cancers and what could be done to kind of bridge some of that
gap. Thank you. So I work in mostly the cancer space, but I also have the privilege, the ability to see from the government side. My husband is the governor of one of the western states of Nigeria, and this allows me to interact with a lot of issues that women at the grassroots level have. So my role here would be to give you that perspective from a low middle income country, what happens at the grassroots level. We have a lot of investors in the room that our Honorable Minister has already spoken and put together what the picture looks like. But for us in the States, there's also a very big issue which has to do with access to care. We're dealing with issues of insecurity, poor knowledge, and then of course the problem of funding. We don't like to talk about funding, but funding is a very major issue when it comes to the ability of our women to access the care that they need. My work is mostly, my foundation focuses on cancer. The commonest cancers in Nigeria are breast, cervical, and then prostate cancer as well. We have an upsurge in childhood cancers where we see a very wide inequity in outcomes despite the ability to cure the diseases. However, we have been able to put together a model state in Kebbi, because my state is called Kebbi State, and working with the government, a lot of the types of partnerships that have been mentioned by Dr. John and everyone else, we operate on a local level. What do I mean by that? We work with the community, such as the traditional and religious rulers, to get our programs, whether it's PEPFAR, whether it's USAID or the national government program, to be accepted. We work with the community gatekeepers so that they can explain to the women new vaccine introduction. We've been able to carry out a pilot of HPV. Nigeria is one of the countries that is yet to start HPV vaccination for the prevention of cervical cancer. So by working with those institutions, we were able to carry out a reasonable pilot, which we published, and this has shown us that there is acceptability if it's available. So the issue is availability. And what is causing the lack of availability is funding. We can do the awareness, we can do the delivery, but for the government to be able to reach those people, it needs a large amount of funding. Nigeria is a massive country, 230 million. So my state is about and I don't mean this disrespectfully, is the size of some African countries, and we have to deal with that reality. What the state government did was to start an indigent cancer fund, which also included like an informal blended finance that includes philanthropic donations, that includes partners, that includes the donor programs that are going on. The USA, the United Success Program is currently running in my state, but it was funded only to 10 local government areas. We have 21 local government areas. So with partnership with WHO, they were able to take care of the training, and then with partnership from the state government itself, they provided a counterpart funding, and it was extended to the entire state. So we're now able to screen and provide early treatment for cervical cancer. My foundation, which is the Medicaid Cancer Foundation, recently announced we launched a new cancer fund, which is 50 million naira. With the extreme rates that we're talking about, it doesn't come up too much. But what we've been able to do over the years with 750 million naira is has impacted over 500 cancer patients directly. So we have this large pool of cancer patients. Some are still dealing with the disease, but a lot of them are managing to survive. Although we do see cancers in very late stages in Nigeria, very, very late stages, they come, and really what we're supposed to offer them is palliative care. I also sit on the board of the UICC. I'm a third-term director, and talking about women in Africa in leadership positions. I recently ran for the presidency, but I didn't get it. For 89 years of existence, the UICC has not been able to produce an African president from the continent. Yet this is the continent that bears the greatest burden. And afterwards, when we were speaking to different stakeholders, it came down to an issue of funding. What programs can you fund my organization with, including the African organizations from the smaller countries? So my point here is for us to move forward and for us to create these workable, innovative finance vehicles, we must look at Africa in a different light. What can we bring to the table? We know that it's not funding. We know that with the exchange rate, it's going to be difficult. The environment is difficult, understanding the system and a conducive business environment that has been mentioned. There is political will in a lot of the areas. Definitely political will is not the problem in my state, but there are other things that Africa can bring to the table. So good partnerships, the seed fund can be provided, even if it doesn't cover everything. So I'm really pleased that we have a lot of female philanthropists that are willing to speak to us, and with the right champions at country, in country level, we can see a lot of difference.
Thank you so much for that. And you know, under this umbrella of the Women's Health and Empowerment Network, you know, started with Dr. Ted Trimble, who I know will address it later. You know, there's room for kind of partners around the room and those on Zoom to work under a sustainable financing working group to look at those implementation projects and those innovative financing vehicles that you're looking at. And I know that others, you know, are looking to scale some of the existing work, because we cannot replicate over and over again, you know, what's already there, but looking at those innovative financing vehicles, you know, a lot of the diagnostic programs to scale, you know, in the countries where they're already at, instead of trying to recreate with, you know, I see USDFC and basically we worked with, you know, in the past from in under different roles. And I think that's where we all need to go to as partners. I'd like to turn it over to the Honorable Michelle Sidibé, that I know you've brokered a lot of these partnerships on the ground, you know, in terms of the expansion of both public and private partnerships. And now under your new role, you know, you heard from Aruna, the CEO of DPI, some of the pharmaceutical industries and the expansion that's going on in the continent. But really in terms of, you know, in the role that you're now in for Special Envoy, how do you see a lot of these partnerships between our, you know, women investors, philanthropists, private equity firms, and the role that the governments play as well?
Thank you very much. And let me start by saying that you are doing excellent work by bringing us on the table. I think that the first start is to be able to talk to each other and not to be developing programs in isolation. Of course, my past experience has taught me a lot. I had the privilege to be deputy executive director for almost 10 years, executive director and the minister of health and other for the government of Mali. Now I'm a special envoy of African Union for the establishment of African Medicine Agency. The first things I want to reflect upon is that traveling a lot, I realized that, of course, the last mile the minister was talking about is certainly the first mile for health security. If you don't reach the people where they are with the program you're developing, and if those programs are not owned by them, of course, it will be very difficult to sustain and transform. And that is certainly one thing I want to mention. The tendency in most of the great programs is that they are generally like a feel-good projects. They are very interesting, they are starting very well with a very committed feeling that they want to transform, but playing to stay with them are always very difficult. So I think that the small advice I can give is to make sure that all those programs, like you were saying, is rooted into local level. Well, it's not, if they don't have local roots, it's generally not owned and it's not sustainable. So I think that is for me very important. And grant or team, if you don't mobilize the resources and all the people saying will not be effective. That's why I want to thank all those people who really are bringing the resources, trying to help to reach the people to where they are or to have an impact. But the challenge from time is that we move quickly from one agenda to another. And we saw that with, of course, we have been not even what I used to be, I think I minister to say, you just stop doing all the services you used to do, and you spend almost a year focusing on COVID. So I want to say that it's very important when we talk about women's health, it's a key program which we need to be maintained, sustained, and cannot be just done and stop and start again and everything. So that's one thing. And lastly, just to not talk too much about the time, I think for me the focus should be more the second decade of life. You know, I spent almost 35 years working trying to push the but I realized that the missing link is that if you don't work solidly on the second decade of life, you don't transform. You have a big problem. Still today, I'm talking about 1.2 billion people second decade of life. I'm talking about almost 1,600 million girls who are, entering rapidly in their discovering sexuality and being exposed to social relations in different ways. So focusing a little bit on this area and selecting good programs there and making sure that from education to health to reproductive health to all those issues become more and say that targeted will make a big difference. Of course, finally, what I'm pushing now is to really make sure that we have a strong regulatory system. I personally feel we've got a strong regulatory system in Africa. We will never have a well-functioning
when you have 30% that want to take to 50%, when you have no capacity really to produce like the minister was saying, or even you can get the medicine at the right place at the right moment because the whole procurement and system are faced with the weak regulatory system. So I want us to say that we are pushing that. We have been able already to make sure that the treaty into force. We have now the possibility to have African certainly regulatory system, continental one. So we are working on that. So I stop there, but I think that is a great idea and what we are doing is just wonderful. Network together.
Thank you so much. So, we look forward to having all the partners under the Women's Health and Empowerment Network. I think Dr. Ted Trimble, who is one of the chief architects of the partnership, there's been a lot of meetings. We have Steph Sassman from Roche and also other Roche colleagues, Joanna, and who have been here from the beginning. And I think as we were talking about the different implementation projects, both from the Nigerian minister, from Dr. Zainab, we have to streamline, how we're working both with the development finance institutions and also the grant. So what goes into grant capital and then what goes into, blended financing? How do we do that? How do we work together as partners? I know Dr. McKinnon-san left, but with the partnership of the U.S. government, U.S. PEPFAR, USMCI, we'll be hosting a summit in June on women's health to look at how we advance this together as partners, both technical assistance and development finance funding together for these projects. So I'd like to turn it over to Dr. Ted Trimble and then really get us practical, as I know John Simon just launched a fund at the White House.
I'd like to thank you all for joining us today, both in person and virtual. We're excited to hear about some projects that are already underway, projects that are planned. I represent the research arm of the U.S. government, and we fund about half the global research in cancer, that related to HPV and cervical cancer. So we're excited about the advances that we've made in cervical cancer, certainly prevention and screening and treatment, which I think led to Dr. Negro's calling for a global initiative focused on cervical cancer prevention and control back in 2018. When we look at the goals that the World Health Assembly endorsed for 2030, we've got a ways to go. But those goals call for 90% of girls to be vaccinated, 70% of women to be screened at least one time in their lifetime, 90% of women that have pre-cancer or cancer treated in a timely and high quality manner, and a 30% reduction. So we know that that's going to take strong partnership in the public and private sector. We're going to have to kind of learn from one another, see what works, see where we need to fix things to make them work better. But we're excited about to have you all here, and we want your ideas, and we want your continued support.
Thank you, Dr. Ted. And I know some of you online need to go. Anne from Africa Invest, and then I'd like to turn it over to Sean after that. But Anne, Africa Invest, has been leading in some of the work. I think you're working together with Total Impact, John Simon on a Transform Fund. But if you could talk to us a little bit about kind of your investments into the continent. You have a lot of pharmaceutical diagnostic partners here that are looking to deploy some of this partnerships together. So what would you do that?
Thank you very much, Joanne. Lovely to see you again. And thank you to all of you for having me come to speak. I'm Anne Wyman. I'm a senior partner at Africinvest. For those of you who don't know us, Africinvest is a Pan-African investment platform. We have strategies that range from private equity to venture capital to debt, and we're present across the African continent. I'm actually speaking to you now from Tunisia. I might be the only Africa-based person today in the room, but lovely to be joining you. Like has been mentioned previously, I think for those who are investing in Africa, like ourselves, like Runa and others, being a part of the 2X challenge is kind of an important element in what we do, being focused on promoting female entrepreneurs, ourselves being gender balanced as an investor, and being focused on women. But I do want to spend a little bit of time today to talk about the partnerships that you talked about, Joanne, and how important those are to us in all of our strategies, but in particular, one that has already been mentioned by my colleague from USAID, which Africinvest and the Health Finance Coalition are leading, and we're very excited to have announced yesterday at the White House, which is the Transform Health Fund. And this is actually a blended finance vehicle. We are grateful for commitments that have already been made from a variety of different LPs and investors into that fund. These will be both DFIs, so whether it's DFC, Swedfund, USAID, but also then commercial and investors such as Philips and Merck. And then we also have a number of family offices. These are all coming together in, I think, in an innovative structure that allows us to really invest in health system resilience across the continent, and particularly in vulnerable communities, and especially in women and children. It's a female-led fund, which I think is also important, women investing in women, and it has quite a number of companies in its pipeline that are female focused as well. So this trickle down to the end investment, we have in our pipeline, for example, a digital mass market retail platform for women's health and self-care products that is increasing access and affordability. We have also a hospital in Kenya that is focused on maternal and child care. And we have a network of low-cost primary care clinics with a focus on women and children's health. And those are just a sampling of the kind of investments that we'll be able to make because of this partnership that we are so lucky to be engaging in with people who are coming together. I think in particular, recognizing that what is required to get these kind of investments done is an understanding that the returns in the near term are not likely to be exceptionally high. That requires catalytic money to come in and start to provide some of the support for others to then create an investable product that will then have more of a crowd-in effect. So we're very grateful for all the partners who are coming together for this effort, which is going to allow us to support health, but also importantly to support women and children. I'm going to leave it there, Joanne, and then if there are questions about the fund, of course, we can answer them at a later point.
Yeah, and I'd like to go and unpack a little bit more of the fund, because we have John Simon here for and Total Impact and the Transform Fund. Before I do that, there's a little bit of math speaking to my madness, is that I'd like to just turn it over to Roche, because I think there's a lot in terms of hitting the base of the economic pyramid, John. But I think, Joanna, one of the things that Anne was saying is kind of that investment that needs to be made in the continent. I know you're thinking critically and interestingly at Roche, in terms of some of that innovative financial thinking, and also how to grow and scale that hub and spoke around diagnostics.
Yeah, absolutely. And thank you so much, Joanne, for the opportunity to be here. I also want to note that I'm very much representing my colleagues from Roche Diagnostics Africa and the work that they're doing. So I'm happy to be their ambassador here today. A key, I think, coming out of the pandemic, there's an understanding now that diagnostics are important and that we need them. And they've oftentimes, I think, been very absent from the healthcare conversation in favor of therapeutics and vaccines, which are also very important. I mean, they're really trying to move on. And our focus is really how we partner to build lab infrastructure that is a lasting infrastructure to enable healthcare across the continent. And today I wanted to talk about one project in particular that we're executing in Tanzania. This is a partnership between Roche, Philips Marburg University in Germany, and the Kilimanjaro Christian Medical Center, where we've all partnered together to develop a diagnostic center of excellence in Moshi, Tanzania. This has been made possible with bilateral funding from the German government that's been provided. And Roche Diagnostics is providing in-kind support to build out the lab. And the Kilimanjaro Christian Medical, they're providing the actual building itself, because labs need to be inside buildings. I think everyone probably knows this. And so this project broke ground in August. It's a starting point, and then we're looking in the next phase to start to think about how we expand this out to be able to provide, primary care, telemedicine. Like, how do you then take that lab, that hub and spoke, to be able to provide all of the necessary services around it? We've also included a innovative sustainable governance model where any revenue that comes in from the lab is ring-fenced, then be invested back into the lab. And I think, Joanne and I were chatting earlier this week, and I was saying how, we're very passionate about the lab and maybe like to hear about that lab. She was trying to convince me that things have changed, but I'll still give my little spiel about why this matters and how this relates to what we're talking to about today for primary care, which is this lab is what can enable so much of the preventative services that are required. You can, women can do self-sampling, collect their own sample for cervical cancer, that can go to the lab for high-performance testing, not only enabling cervical cancer screening for an entire region. And there's an example after example after example like this, where we get this core infrastructure in place, it then enables us to put all the other things on top of it for real lasting impact. And so I, again, just like to thank you very much for the opportunity to be here today and to share this project. And I think we're very eager to continue with other types of partnerships to be able to do more work like this going forward.
Thank you. And along those lines, as we said, through the Women's Health and Empowerment Network, we want to work on the sustainable financing, like Dr. Zainab brought up, like the Minister of Nigeria had brought up. Also in terms of implementation projects for diagnostics. And then I know that there's an innovative financing vehicle that Anne had spoke about earlier that I know John Simon has also spearheaded. And I think this is a lot of creative thinking. And I'd like to also bring in USC FC after that. So over to you.
Thanks, Joanne. It's great to be here and to be here with my colleague Anne and Dr. Otul Kwande and Monisha, all of whom are partners in the Transform Health Fund. I'm trying to keep this on the we missed, but it's quite, as Anne was describing, a broad partnership. It really began on two parallel tracks. One was Philips, the Dutch healthcare company, that was recognizing that there needed to be a build out in the primary care area in Africa for them to actually be able to do their business. And that, that they have amazing, just like Roche, technology that can make a real difference on the ground. The work, the clinics, the hospitals, the referral chain, the supply chain to get those products to the people who use them best. And on the same side, there was the ambassador for global strategy for the World Health Organization, Ray Chambers, who was recognizing that if we're going to actually achieve SDG 3, we have to mobilize a lot more capital than what's there together. And these two folks came together with the idea that we need a financing vehicle that can really tackle the challenges to the obstacles to the mobilization of capital. And those obstacles, basically, I'll mention three of them, and how the structural fund is designed to address them. But they're all derivative of the fragmentation of the health market. Fragmented on both the supply side, with lots and lots of little enterprises that don't tend to get to scale, and fragmented on the demand side, where you have a whole bunch of payers who are stuck in their stovepipes and aren't in essence leveraging their financing to create efficient, effective delivery systems. So one of the things that was clear when we began our work was the recognition that while the needs are vast, the opportunities to invest are actually somewhat limited. And so what you need is what we call a construction function to help develop the opportunities that exist into investable opportunities. And so as part of the Transworld Health Fund, there's the Health Finance Coalition's construction effort, which really takes grant-funded technical assistance to build up opportunities that have promise that serve the bottom of the pyramid, but that aren't quite yet investable, that can be investable with time. The second, and Anne mentioned this, is the fact that there are many opportunities to make a real impact in the health sector, to have sustainability, financial sustainability, but they don't necessarily hit the typical hurdle rates, the type of hurdle rates that Bruno was referring to with regard to what investors are looking for. So you need a blended capital structure with lower cost capital mixed with more commercial capital that could allow entities that could be sustainable but not necessarily deliver 20 plus returns, still achieve finance. And the third element was to focus on self-liquidating exits. So, a lot of the types of enterprises we're investing in, including several public-private partnerships, they're not going to have a sort of trade sale or an IPO or something like that. Instead, the focus of the investment is on things that can generate cash flow over the long term, perhaps by leveraging donor financing, by leveraging government finance, concessional financing, and using that to give the investors a reasonable return and deliver the type of impact that will make a real difference on men and women and children on the continent. So thanks a lot. We're very excited by yesterday's announcement. It's just the beginning, but we're looking forward to a lot more.
Thank you. And I know that the development finance institutions around the room are going to be working. I know Christina's there in education, but I'd like to turn it over also to our colleagues here from USDFC, and then over to Christina from European Investment Bank. I know USDFC has done a lot of creative partnerships for, COVID and other things. And really, I think we're looking forward to working with you in the deployment. We have a lot of women investors and philanthropists here and that are looking to work with the Women's Health and Empowerment Network. So if we could hear a little bit more about USDFC's strategy in terms of gender investing in health.
Great, thanks so much, Joanne, for having us here today. It's nice to see some familiar faces in the room. For those of you who don't know us, so first I'm Monisha Ashok. I'm the Assistant Executive for Health Initiatives at the DFC. The DFC is the Development Finance Corporation. We are the U.S. government's development finance institution. So we work very closely with our other development finance institution counterparts that we've heard from, a few of them today. And health is one of our top priorities. Within health, we have three main focus areas. So the first is around health services and infrastructure. So this is really the working together hospitals, health clinics, pharmacies, diagnostic centers, and that can span from primary care to tertiary care, address infectious diseases, or advising for as well. And of course, women are often disproportionately affected by health areas. Women are a large percentage of the health workforce. And so a lot of the health services investments on and our second area is around health commodity manufacturing and supplies. So you might have heard about some of our investments in vaccine manufacturing, COVID, and as well as vaccine access, value. But we're really looking to expand that beyond vaccines to now diagnostics, to therapeutics, to ancillary supplies, and other products. And there again, there are contraceptives or other types of products that are with health. And our third, the final area of focus is around intersectional health technology, so digital health. And so this could be either content applications that support patients and providers, or back-end applications And, you know, across the initiatives, we work very closely with our Gen on our 2X initiative. We work with a number of funds on the 2X challenge. We call that the 2X initiative. But it's really focused on and whether that's investing in women-led funds, like the Traditional Health Fund, or whether that's investing in entrepreneurs, or whether that's investing in companies that are targeting women as their customers. So for example, we have a partnership with USAID and Work for Mothers called Finding for Moms that's focused on investing a mix of grant, debt, and technical assistance from the various companies focused on maternal health. And you know, we're eager to do more partnerships like that. You know, maybe I'll just give you one example. In terms of our financing tools, actually, so GFC has long been focused on debt. That's really the debt financing platform. That's really our bread and butter along with work policies. As open transformed into GFC, we have new financing tools as well as technical assistance that really helps us target earlier stage. So one of our first equity investments was Kasha Global, which is an e-commerce platform in East Africa that sells and distributes products, health and also hygiene products targeting women. We have a consistent discrete delivery model that is designed to reduce stigma around some of the health products for women. Maybe back over to you, Joanne.
Yeah, no, we're looking forward as we're deployment and looking for those projects that we can work together to announce. You know, I'd just like to turn it over to our colleagues from the World Bank. I know we've been doing a lot of different thinking, and you know, Dr. Zainab had, you know, Her Excellency focused on kind of that innovative financing work around women's cancers. And so, you know, if you can offer some thoughts around some of what the World Bank is thinking in these areas of gender, you know, women's cancers, and before we turn it over to our colleagues from the European Investment Bank.
Thank you very much, Joanne. There was something Dr. Sidibe mentioned just before he left, and I believe that's probably the crux of why we're here. Dr. Sidibe, in fact, highlighted that the future of Africa lies with its adolescents. The future of Africa lies with its adolescent population. He referred to that population as the second decade age group. I put that in a technical term, ladies and gentlemen. A third of the economic growth in this area was due to their movement in terms of their demographic transition. A third of the economic growth was because of what they were able to do. If you look at African countries today, we are not doing well in terms of our demographic transition. And the possibility of reaping a demographic dividend is fast disappearing. In fact, for the Nigeria of a country of 214 million people, we are so delayed in our demographic transition, we are referred to as a free dividend country. There are some countries that are making progress, Ethiopia, Rwanda, Ghana. They are early dividend countries because their total fertility rate is below 4. Nigeria is 5.3. What are those things you need to do to make progress quickly? You need to provide family planning services, maternal and child health services. Girls need to go to school. You need to empower women. As basic as those things are, they're not delivered at scale, they're not publicly financed enough, and so services are not delivered. So in fact, economic growth might be stalled. And that's why this discussion is important. How do we take to scale maternal child health? How do we expand family planning coverage? and also empower women so that they can have autonomy and be empowered to access health services. And I give a couple of examples. First is, and that's a big point I want to make here, it's good that we have philanthropists and private equity firms ready to put financing on the table. That's great. It's a sufficient, it's not a necessary condition. The necessary condition is the public finance that the governments of countries put on the table. Without that, every other thing we're talking about is poetry. And I'd like to just round up with some optimism or optimistic position. First is to say, and I use the example of Nigeria where I work. So the government of Nigeria has committed 1% of the consolidated revenue fund to basic primary health care, for the basic health care provision fund, which is a good initiative, great, and it provides opportunity for private sector partners around the table and on the call to see how can they leverage on such public financing. A second one, which speaks to the focus of this meeting, is a cancer health fund. And that also gives an example of how the private sector and public sector can work collaboratively. In fact, through the financing provided by World Bank and IFC, we got a couple of private sector partners together. We designed the Cancer Health Fund, and the government of Nigeria put money into it, which is contributing together as a family. It's important because that fund prioritizes accessing care to the three commonest cancers, prostate, cervix, and breast. Women, unfortunately, today are burdened by the double burden of disease, and the poor are not left out of that. The third point to say, and I think it's important that we're able to have our colleagues from the Sovereign Wealth Fund in the room, because if you look at cancer care now, the government of Nigeria has the Cancer Health Fund, which allows the poor and vulnerable people to access care and reduce out-of-pocket payments. And you have the Sovereign Wealth Fund making investments on the supply side of things, making the equipment available and all that. It then means that, one, you have partners who can invest either through some blended financing opportunity with the Sovereign Wealth Fund. You have on the Cancer Health Fund, philanthropists who can put money to allow more women access that care. And third is, of course, opportunities always are available with institutions like the World Bank, where I work for, and such concessional financing is always available to governments to expand basic care. Thank you very much.
Thank you very much. And I think it's exciting what you put down on the table in terms of, the blended financing. I think, we had Dr. John Higgins on here earlier and Dr. Atul Gawande, and all of them, are talking about that, blended financing that we can get around the table. And I get your point with the development finance corporations. We have British Invest International, the European Investment Bank, and also we have over 50 women investors and philanthropists online for this summit. So we are looking forward to working, closely with you in that, blended financing fund of how we can aggregate the capital, because you've obviously done amazing work, in terms of this fund. And, Dr. Zainab, and I think there's a lot of opportunity to add private sector invested. So hopefully, under Ted's leadership at the Women's Health and Empowerment Network, we can look at not only implementation projects, but also those sustainable financing projects that, we've looked at in the past. I think, in terms of deploying with the Islamic Development Bank and also the International Atomic Energy Agency, I know the Center for Global Health Development that I head up had looked at some of those mechanisms. And although people said they were impossible, we were able to aggregate some technical assistance, money coupled with private equity funding into it. I think sometimes it's confined, again, not lack of money, but how we're designing. And I think that's where we need to be creative as we're working within sustainable financing for how we create it. Because the money's there, it's just sometimes the vehicle is created the wrong way from the onset. And so that is what causes it to fail. But I see, in terms of colleagues and a lot of the innovative financing and thinking that, has gone around, the Nigerian Sovereign Wealth Fund, and the thinking and announcement that has, recently been part of the discussion with Varian. We have, both the leaders here around the table. And I was wondering if you could, comment to, how the partnership came about and, that with some of our women investors and philanthropists at the table, how we can think differently about how we design these structures.
Brilliant, and thank you for the opportunity to do that, as well as join some of the discussion. I wish could have been here for the entire session, because the topic in which we were doing, thinking about these elements of bringing together government, understanding local challenges, and then creating almost what I've envisioned as a triangle that reinforces the patient at the center of the opportunity to provide sustainable care is so critical. I'm Chris Toth, CEO of Varian. Varian is a world leader in radiation oncology, looking at cancer care, cancer therapy in the context of women's health. We lead with radiation therapy for breast cancer, as well as looking at cervical cancer care and many other diseases that will interconnect, and obviously both men and women being affected by it. But those two that I referenced very specifically tie well into our picture of the company. In April of 2021, so this last year, Varian actually combined with Siemens Healthineers. We have a 70-year history as Varian being concentrated into cancer therapy. And being very large in a global footprint, one of the elements we realized very quickly is having just a discussion about therapy without adequate infrastructure for diagnosis and being able to change the population to help figure out where disease is a gap. So we brought the two companies together to really represent this end-to-end ability to start with screening into diagnosis into therapy. Being here this week has been absolutely inspirational. I serve on the President's Advisory Council for Doing Business in Africa. This is my second term. If I were to compare and contrast how I feel about the conversations that are happening this week, I feel like we're really talking about a step forward from not only it being a discussion of communicable disease, but how do we build infrastructure for non-communicable disease as well? As we look at the population across the continent increasing and essentially doubling between now and 2050, building this infrastructure in a scalable, sustainable way, and taking the learnings of where mistakes are in many parts of the globe, where opportunities for improvement, efficiency, and quality of care are so important. And I co-chair the health subcommittee, and I lead the workforce development group. And the only item I wanted to maybe add into some of what I heard exchange is I also believe we have an amazing opportunity. You said this a little bit about the youth and really that movement as we think about the younger generation coming forward. We also have a chance, if we create the infrastructure in the right way, to be able to have sustainable jobs and careers that are very meaningful and impactful in the country. And to be here with my colleagues from Nigerian Sovereign Investment Agency and the work that's being done with the Wealth Fund, that's exactly what we're seeking to try to accomplish together. In fact, the scope of what we are here to sign today is looking at a next step. We actually have already done a proof of concept where we have built the largest cancer center in the region by far. We have shown the capabilities, but what we've realized is we now need to think about the next level of scale. And Varian as a company, one item we have done is we've now not just looked at providing devices, but actually providing services and support for the clinical capabilities. And to digitize much of the clinical process so it can scale. And that's really what I would say drove our partnership to this next level of how do we think about multiple new centers? How do we think about partnership around training and education? And maybe not even just in the context of clinical care, but also for training for biomedical engineering. Those are very important jobs. So this is what we are seeking to do. And we know, back to the government funding point, there's always two sides to these discussions. And from the U.S. government perspective, we're looking forward to leveraging the discussions we have and the relationships we have to try to help with that workforce development. And one of the exciting elements, of just maybe to note before we go into the signing here, and certainly want to give opportunity for any comments for my colleagues, is that 2 of the units as part of this picture are breakthrough. Cervical cancer is absolutely a challenge across the region. And brachytherapy represents a much more modular, very direct way with high efficacy ability to treat that disease. So we felt that also created a very nice opportunity to announce it here. So please, if you'd like to add anything before we sign.
Thank you very much, Christoph. A great pleasure to be here as well. My name is Aminu Sadiq. I'm the Managing Director and Chief Executive Officer of Nigeria Sovereign Fund. Very briefly, by law, we have 3 separate arrangements. One of which is the domestic fund. Within that fund, healthcare is a focus sector for that fund. And one of the strategic priority areas of healthcare interventions around co-locating tertiary institutions, particularly around oncology propositions. And typical of us, we like to undertake short projects rather than specific projects so that we can understand what it means to actually actualize an oncology center. What does the demand side look like? What does the supply side look like? How should the capital flow? What kind of training residents require? What should the patient experience be like? Thanks to our partnership with Varian, we spent the last 18 months, 4 months now, making that happen to the extent that we are comfortable around the idea of collaborating beyond that one sector. To answer her question even more directly, where do we see this going? I think first is we've had a good discussion around that earlier. The first is we need to find a way to transition from service provider client type relationship to a strategic partnership relationship. We need to go beyond selling equipment and being a buyer of that equipment to a complete collaboration that is offering what both actors can do to advance treatment of cancer. I think the second is Varian no doubt have a global experience as it relates to cancer propositions. We would be ideal beneficiaries of the combination of all their experience, of all these case studies that they can bring to bear as we undertake collaboration. Thirdly, which is what my colleague mentioned earlier, an underground platform from Varian in Nigeria would also be as it relates to the ability to basically be there. And so we're working around how to ensure that that partnership is even more perfect.
And I'm sure you're looking also to work with the partners around the room in terms of that end-to-end care, getting the patient referral system, and also getting a lot of what's needed to get the patient into facilities. So I know that there's a lot of partners around the table that are thinking innovatively of how to do that, and also a lot of other diagnostics that are needed for that end-to-end, women's cancer care that's needed. And I know we're going to sign, and we have Kay on the phone, Chief Financial Officer from Roche, Steph, and so we're just going to sign for a second, and then we're going to turn right over to you. So we're just going to take a quick photo. What a great moment in time. I'm already getting texts from some of our women philanthropists and investors on the phone that, they're looking forward to, working in partnership with some of the partners, you know, and moving next. I know that, you know, before we conclude, I'd just like to turn it over to a couple of people. Steph Sassman, you know, has been really with us for, you know, that, you know, Women's Health and Empowerment Network since the beginning. And I'd really like her to give some comments and then over to Kay, because I know there's an exciting Unlocking Eve initiative, and Christina for the European Investment Bank. And last but not least, our colleagues from UNAIDS, who are partners in the Sustainable Financing Working Group, which will be housed under the Women's Health and Empowerment Network. Over to you, Steph.
Thank you so much, Joanne. My name is Stephanie Sassman, and I'm the portfolio lead for women's health at Roche and Genentech, which are one company. And we're really on a mission to transform women's health from diagnosis, which Joanna spoke about, to access to medicines and care delivery. And we really want to do this in line with our goal of doubling medical advances at half the cost to society. And as Joanne mentioned, we've been very pleased to be a part of WIN from the very beginning. And really, it's filling such a vital role because the challenges that have been so well articulated by many of the speakers today are only going to be solved through multi-stakeholder partnerships with funders, with health systems, with startups, pharma and diagnostics companies, other entities like Varian, with bold first ladies like Dr. Zainab, who I know is in the room, and bold health ministers and bold leaders from the World Bank like Olamide, who just spoke very articulately. And really, it's because we all have a shared goal. And what we want to advance is long-term, sustainable, and systemic solutions. And talking about women's cancers, it really needs to be end-to-end throughout the patient and health system journey, starting with awareness through screening, diagnosis, and accessible treatment. As Chris was just mentioning, it's really about all the treatment and care and diagnosis that a woman needs so that we can actually enable women to survive and thrive, and really supporting the gender health equity as well as economic advancement, because we're talking about decades more of life for women who are really the empowerers of the economies in these countries. And so we're really eager to continue to discussing when with all of you and how we can advance sustainable financing projects and implementation projects for women's cancers in Africa. I just did want to call out Nigeria is an area of major focus for us. And I know we have some very important stakeholders from the room there in Africa, in Nigeria. And we are partnering there with Dr. Zainab and the First Ladies Association, as well as Odumide and the World Bank. My colleague Chooks is in the room, and he's been involved in establishing a health fund in Nigeria that we're really eager to grow and help make a bigger impact for women, because really at the end of the day, that is why we're all here. So with that, I will hand it over to Kay, who is also a part of Roche and a part of a very important initiative on empowering women in leadership.
Thanks, Stephanie. Hi, everyone. I'm actually here with Ava McClellan, who's also in the Roche family, but also in a co-founder of Unlocking Eve, which is the foundation that we started last year. But I want to talk first about women in finance and why that is important. As Joanne mentioned earlier, there's not a problem of funding, but it's really how to deploy the funding. And I think to have women in leadership positions or decision-making positions in finance to be able to allocate the resources, you need to be able to understand the constituency and the community that is being represented. So, you know, for me as a person of color, but also as a woman, understanding what we are going through within our patient population, but also in leadership. This is something that I carry with me as a finance leader in Roche, but also as we're trying to build our organization of Unlocking Eve. I think as we are being faced, as all of us are leaders here, as we are faced with really different criteria to make decisions, it's not as simple as just funding or P&L. we really need to deliver healthcare outcomes. That's why Unlocking Eve was born. This is really our service to the world and to Africa to make sure that we are building the right leaders that have an integrated characteristic to be able to create these decisions in these complex environments. So Ava will share, her experience in the countries in Roche and also Unlocking Eve leadership.
Yeah, just to double down on that, we've heard from a lot of you in terms of what's needed, what are the barriers and accelerators. And one of the things we're on a mission to do is unlocking this new kind of leadership in both men and women. Nowhere is it more evident that leaders than in healthcare. Specifically, women make up 52% of the population. 70% of healthcare workers are women, and those making decisions for health outcomes of their families and their societies are women. Yet very few are in decision-making roles. And so this mismatch, which we suspect and we know is also the case in the region and continent of Africa, is what really strikes us. How do we ensure that those accountable for health outcomes for society, for men, women, kids, girls, and boys, are also at the table designing the systems for which they're fundamentally responsible of the outcomes? And on the second thing is, how do we ensure that leaders, that once they get into those decision-making roles, again, women, but also the leaders that are in the current decision-making roles, whether it be in finance, ministers of health, anybody accountable for healthcare, have the necessary skills to lead in a way that is integrated. Because during the pandemic, we started to observe globally leaders that were able to deploy both decisiveness and kind of the traditional traits attributed to masculine leadership, together with compassion and empathy and the traits traditionally attributed to feminine leadership, had 6 times less deaths due to COVID-19 than countries led by leaders that did not have that integrated way of leading. And so that really sprung us into action to really work with leaders across the world in terms of having resources and having scaffolding to, one, build a purposeful driven network of decision makers, working with those decision makers to change the criteria for what excellence in leadership ought to look like, and then working with communities. And we're coming to Africa in April and looking at what are the systemic barriers and accelerators that these leaders are experiencing that maybe we need to either accelerate or remove, so that when they get to those positions, or those that are already in those positions, certainly women, but also men, that they are able to lead differently, because that's what we're hearing around the world is a big unlock. So if you believe in the notion that unlocking this new form of leadership, if you yourself are struggling with partnerships, it's really easy to say, but how do you lead as a co-partner? What does leadership look like in a co-partnership? How do we create shared outcomes? And then how do we deliver against those outcomes along the way? Those things are easier said than done. Having worked in many, many countries, delivering outcomes, delivering P&L, we say partnership, but it's much harder. So how can we work together to really advance that? So I think that's all we wanted to share, but anything other you wanted to close on, Kate?
No, thank you. Thank you, Joanne, and everyone in the room. Take care.
I know that there's a lot of exciting momentum around Unlocking Eve, and I, just want to thank, a lot of the partners. We have Vinay here, who's a dear friend, but also now leading a lot of the work at UNAIDS, that's Washington, D.C. based. And I think a little bit of this discussion is really meant as a momentum for the summit that we talked about that we're hosting in June, and really looking at what are the projects, what are those implementation projects, what are the sustainable financing projects that we can look at to grow and scale with women's leadership, at the head of the table. So I'd like to turn it over to Vinay, and I know that we talked about earlier about the Sustainable Financing Working Group and really getting partners under the Women's Health and Empowerment Network to work for some of those projects, and really eager to work on HIV/AIDS.
Thanks, Joanne, and congratulations, Joanne, and to the whole team at PhD for convening today's really important summit. A lot has been said, and I, on behalf of the United Nations, on behalf of UNAIDS, We fully support the engagement and leadership, in particular, bringing on blended financing, stable, really promising, very timely, important mechanisms to really engage all partners, particularly from the private sector, to be the dialogue in Africa, in sub-Saharan Africa. Let me just share just a couple of points from our recent World AIDS Day report. We did some new analysis looking at funding trends on HIV in sub-Saharan Africa. And there is a misnomer, almost a myth in many development circles that the more international development partners put in, the more the PEPFAR puts in, the more the Global Fund puts in, it actually lets partner countries in globally, including in Africa, so to speak, off the hook, and therefore there's a risk that they will be putting less funding. So we actually ran the numbers, and we came across a very interesting list of 9 countries that for the last 4 years, 2018, 19, 20, and 21, had significant increases in funding from PEPFAR and from the Global Fund. But they were matched by significant increases in domestic financing for HIV in these countries. Countries are, and this is not all the countries where this is happening, this is only the countries where we got reports of UNAIDS and we were able to actually do the analysis. The full list may be longer, but Botswana, Ghana, Lesotho, Malawi, Mozambique, Nigeria, South Sudan, Togo, Tanzania. And so these are countries that are facing a number of different public sector pressures, but in a sign of global solidarity and shared responsibility, the governments are stepping up, perhaps even outside of their comfort zone, to provide more funding for HIV and also leverage the potential of decades of investments in HIV to put them to work for larger progress across the health sector, including for women's health, including for maternal and child health, including for non-communicable diseases. And across all of these areas, they produce many-fold investments beyond just HIV for women's health and women's empowerment across sub-Saharan Africa. So on behalf of UNAIDS, we're very pleased to be joining the Women's Health and Empowerment Network. We will, and I've agreed this with our sustainable financing team, also be joining the Sustainable Financing Working Group. Happy to contribute to the work in this area and really look at strategically how can we move forward and build on progress in HIV. AIDS is not over, particularly in sub-Saharan Africa. There's a lot of work to do, but the opportunity we have now by really putting these amazing constellations of partners around the table to look at strategically how can we put these investments in these partnerships to work with, to work for not just ending AIDS, but to really move the dial very quickly, even before 2030, on women's health and empowerment. Thank you.
Thank you so much, Vinay, and we really look forward to working closely with UNAIDS and the WEN Network. Christine, I know you've been patient, and the European Investment Bank, has done a lot of interesting, investments in this area. I really wanted to turn it over to you. Really see you as a critical partner, in some of the work ahead, and how we work with the Women's Health and Empowerment Network to deploy implementation projects and also sustainable financing. Before we conclude, I would like a follow-up from our colleagues in Nigeria on some of that, and from the Ministry of Finance for Botswana. But over to you, Christine, and thank you for the women investors and philanthropists. There's over 50 of you online, so thank you for remaining on for this important summit.
Thank you very much. It's quite late here in Europe, so in Luxembourg, where let's say we are headquarters. The European Investment Bank is the investment bank of the European Union. We are, I think, the largest multilateral development bank globally, the larger investor. Just very recently, I think our board of directors have approved an envelope of 25 billion to support impactful, and this was the word that was said. We need more impactful investment. So in the recent round of investment, we supported initiatives like purchasing vaccines through COVAX, and not only COVID vaccine, but more African-related diseases and women diseases. We have spoken about human papilloma virus and other, let's say, women targeted diseases, specific vaccines. We provided investments in or guarantees to Gavi, again for impactful investments. So I think that it is clear to us that we have to support, let's say, all African initiatives with impact in general impact, but we have a specific focus on women and girls, in gender equity, and in empowering women economic empowerment in these countries. Across different areas, we have new businesses in transportation, in health, education, clean energy, climate action, and all these are linked together to put health at the, let's say, and women at the, let's say, core of our investment. Being a European institution, we have to follow the European Union Gender Equality Strategy and the EU Gender Action Plans, which have put a very short term by 2025 that 85% of all new initiatives and external actions and investments should have and should contribute to gender equality. So we have internally different policies, like EIB Group Gender of strategy on gender equality and women economic empowerment, and an action plan to provide us with a framework on how to embed gender equality in our EIB and EIF operations. We have the EIB Climate Roadmap, again, to commit on gender equality strategy and to support gender responsive climate actions in the years to come. We are investing in women entrepreneurships and fund managers in climate focused sectors to scale up their business in health, again, the same. We have the EIB gender tag, which enable us to identify, to track, and to report on operations that are likely to contribute to gender equality and how to do it. Of course, I don't want to keep it too long. We have 4 major, let's say, pillars: how to protect the girls and women rights, and that our investments are not negatively impacting this, what has been achieved in this women rights so far. So we have to pay a particular attention to gender-based and violence and harassment that are totally, let's say, diminished in the years to come. Impact, how to enhance our positive impact in lending, in investment choices, in design of our financing to enhance access to our products and services. We have to invest, we have the 4th pillar, which is invest in women empowerment and entrepreneurship. We work with financial intermediaries, with local banks to bring this, let's say, to create this environment. And at the EIB level, institutional, we are trained. Myself, I'm not a gender specialist, but we are trained to bring and to identify projects that have this gender impact and to put them forward on our investment agenda. Just one example to be more concrete, the EIB has created back to 2019 the so-called She Invest initiative. I think that we have committed 4 billion until today. 2 billion have been already deployed for African women and girls. 2 billion will be deployed for Asia and South America, if I'm not wrong. We want to make this money to benefit for 1 million of women across Africa. And we have a specific focus on investment in innovative digital solution and financial products to reach women and girls who are often excluded from such services, and hence increasing their economic opportunities and their social inclusion. Just two examples out of this investment, we signed 15 million loan with the Uganda Development Bank, and I think 20 million the same with the Development Bank of Rwanda. And we blend, because we are spoken with this money with, let's say, some form of grants to all the NGOs like Africa Women Rising Initiatives, which are helping those women, those entrepreneurs to let's say to work with us, to work with their national banks to get access to the right financing. So we, to conclude, the EIB created also a new branch that is called the EIB Global. We want to have a more local presence to identify the right projects locally, to connect with all important or all partners, local governments, DFIs, NGOs, to bring our, let's say, impact financing there where it is the most needed. And thank you
so much,
for,
Christina.
for inviting us tonight or today.
No, and we're looking forward to having you, as part of working with us in that Sustainable Financing Working Group, the European Investment Bank, that she, I completely forgot. That is an amazing initiative with all the billions of funding, as we said. It's not lack of funding, it's how we're structuring it. So we're really looking forward to working with you and a lot of that, capital within that initiative to deploy into both sustainable financing vehicles that Dr. Zainab mentioned, and then also, some of those implementation projects. So really looking forward to working with you. Honorable Minister from Botswana, has waited patiently, and I'd really like to thank you and really talk about some of the inequalities and how the partners here can work at some of the projects that you see as important in Botswana. But before we conclude, I'd like to turn it over to our colleagues from Nigeria. But over to you.
Thank you very much, John. For organizing this meeting. Very important. I have so many take homes, and maybe I'll start taking some of the partners I can see. I also want to thank Peppa for the contribution in Botswana and Namibia. We managed to succeed in a number of people to achieve the 95%, and we also managed to reduce the mother child conflict from 40% in 2000 to less than 1%. And we also got the silver and celebrated for that. And it's because of the work of partners, Peppa was not alone. We believe in the work of NGOs in Botswana to the extent that in 1995, we established a body that coordinates the NGOs, the Botswana Council for NGOs. And since we established that structure, the NGOs are now well structured, and we will have a cluster of NGOs dealing with health issues, working with the Ministry of Health, cluster of NGOs dealing with education, but all of them work through this council. And we managed through those partnerships. The government then decided that we will provide some grants to NGOs. As you know, Botswana, we are close to 70% contribution of the domestic development fund to our government expenditure. So only around 50% will come from outside. And out of that 70%, part of it will go straight to NGOs as grants. And some of these NGOs are feeling effort in the area of economic development, empowerment, and health areas. So the government of Botswana believes that NGOs can augment their efforts. So the partnerships are not only between government and NGOs, as I talked about development partners, they also work through NGOs. And also the private sector. There's one NGO I always talk about, the African Women Leadership Academy. We is an NGO which started operating in 2010. They are looking at areas of leadership, they are looking at areas of leadership development, at networking opportunities. And when you look at a number of girls who graduated from the trainings they do, a number of them, and they are able to penetrate the system and just having gone through this training. And they haven't got a feedback from government, they are partnering with private sector. So you can see there's private sector here, there's NGO, there's development partner, there's government, and all of these entities working together to empower Botswana, to empower women, to empower girls. And the government is now realizing that more work needs to be done in the area of empowerment. Whereas partnership before was donations, commodity, but now we are taking more empowerment. And as I was listening here, I could tell that there's a number of partners that we that we complex this agenda.
Thank you so much. And before we conclude, we started with this innovative financing funding model in terms of what Nigeria is doing, and I just wanted to give you the opportunity to comment on some of the what we discussed around the table around gender equality and a lot of the innovative work we do in Nigeria.
Thank you very much. I think I want to, like you say, Nigeria standard existing protocols. I have two of my colleagues here, the Director of Public Health, Dr. Alex Oku, and the Director of Food and Drug Services, Pharmacist Ariana. So just to expand on some of the things Honorable Minister has said already, I was going to talk about the demographic transition, which is one of the key areas that we need to address in order to tackle the issues around women and children's health. We also look that as part of the National Health Insurance Authority Act, Nigeria has also established a vulnerable person fund, which is another innovative way of mobilizing resources to address the primary issues that are key to women and children. Also, under the basic healthcare protection fund, we have the ambulance services, what we call the NEMSA and the emergency medical treatment. That provides opportunity for everyone, especially women, access at the most difficult time. So the ambulance, one of the studies we had showed that part of the major causes of maternal mortality is lack of access during a crisis, during labor. So that's one of the issues that the ambulance service is addressing. Also, the other part is the pro-health taxes, which they're not having mentioned here, the so-called SIM taxes. During the 2022 budget cycle, the government approved the pro-health taxes as part of the act that passed the budget. So, working with the World Bank and all the other partners, we're looking at how to institutionalize the pro-health taxes. The pro-health taxes is basically the address issues of young people, but also we know that it acts with children very, very much. One of the presentations that we started giving this period is also say that we cannot, like the way we say that global health security, the state side of health, we cannot address issues around women's health without looking at the health system. And so one of the key areas where we would like to partner with everyone here is the issues around availability of pharmaceuticals and drug substances. Those are very key to women and children health, and of course, laboratory devices, commodities and devices. Those are also very key to the issues around women and children health. The health infrastructure and technology have really been taken as an area that we can all work together, invest in order to impact the health of women and children. And lastly, I want to speak around work, not lastly, logistics. During the COVID, one of the key elements of the key areas of challenge is around logistics. So ensuring that we support find innovative ways of financing logistics, in order to provide support, service provision for women and children, key success area. And then, of course, I come to the final one, we can't, we need to, there have been so many interventions in the past. We need to know what happened, how can we make them better? And so that issue around research and development remains critical. And of course, nutrition is a key area that we need to invest in. Nutrition is like the medicine, all of us are involved in that. And so in order to ensure that when we do that demographic transition, we're not just focusing on issues of family planning and maternal and childbirth, but we're also empowering women. It's about empowering the population to make the right choices. It's about empowering the women to make the right choices, to be able to be who they desire to be. And so part of that is looking at the business of healthcare. So how can we, basically fund the business of healthcare? I think I said it.
Thank you so much. And before we conclude, I just want to closing words from Dr. Ted Tremble, who has been, co-leading the Women's Health and Empowerment Network, from the U.S. National Cancer Institute. And I really want to thank, before I turn it over to you, to the women philanthropists and investors that have been patiently with us and really getting messages, and they're revitalized by a lot of the discussion and want to work hand in hand with some of the partners and projects we talked to. So we will call upon you. I know you're online, and thank you for the comments, and we're really going to be working with you as we move forward with this sustainable financing working group that partners such as UNAIDS and others have committed to working closely with. So over to you, Dr. Ted.
Just want to thank everybody who joined us. It's so exciting to see all the UN agencies and development banks, NGOs, entrepreneurs, and investors, and those who work in countries for ministries of health and to make things happen.
Thank you. And I really want to thank my team, Anthony, our Senior Vice President, Francesca, Director of Policy and Research, Jose, Alan, who I know is on, and other team members from the CGHC staff who really couldn't do it without you. So thank you to everyone, and we're looking forward to working with everyone before the next June summit to get things done. Thank you.